Hi, everyone. This is Lynn Crawford with Hope Dementia Support, and we're here with our friends from the Agency on Aging and Disabilities. This is Willa Evans and Chasity Charette, and I'm going to ask them to tell you a little bit about themselves. Go first.
Sure. I'm Chasity Charette. I am the health educator at Agency on Aging and Disabilities. I have been there almost 5 years now. Worked my way from reception to now the health educator.
My name is Willa Evans, and I'm a program coordinator at the Area Agency on Aging and Disabilities. And I started out as a case manager, coming to the agency after being a caregiver for my grandmother and my great aunt. And I spent 7 years as a case manager, mostly in the Family Caregiver Support program. And then I was the health educator, and now I'm a program coordinator.
We're delighted to have you. Thank you so much for being here. Now, as we progress, you probably will have questions, and what I'd like you to do is to put them either in the chat or the Q&A, and then we'll ask them at the end. So go forward, ladies.
Great. Well, thanks for having us here today. As I said, I'm Willa and this is Chasity, and we're going to share tonight about what our agency does and the programs and services that we offer that might be of benefit to you or your neighbors or other people that you know in Southwest Washington. I'll give it just a minute here to pull up. I'll let you do that. We have a little PowerPoint presentation to go along with our talk tonight. Did you find it?
It is there, so just a moment.
The joys of technology.
Yes, technology. Okay, let's do this full screen and we'll get it shared again. There we go.
There we go. Thank you. And so you can go on to the next slide. Thank you. So my first question is, are you a person for whom our programs might be helpful? So if you think about, are you helping a friend or a family member with transportation, personal care, coordinating medical appointments, shopping, or other tasks? If you're taking care of a grandchild or a niece or a nephew or other child of a family member, if you're thinking about what to do if you or a loved one need care assistance and decide that you're no longer going to be living in your home and you're wondering how to move forward with that. If you're feeling down or lonely or disinterested in things in life and you're looking to improve your standard of life, your quality of life, or if you're wondering where to find answers to other questions about long-term care or how to talk to someone about giving up their car keys, or how to share your concerns about a loved one's restriction of rights in a care facility. If you fit any of these, then we probably have some sort of service or program that's helpful for you. Next slide. Thank you.
So what is an area agency on aging? Well, there are more than 600 AAAs nationwide, covering every country or every county and parish in the country. Not all look the same. There are some differences in services and programs that each of them offer, but all operate to provide access to services for older adults and often adults with disabilities in the home and community.
Sorry, guys.
It's all good.
Okay.
Uh-oh. We have an echo in the room. We're gonna get that taken care of. So there are 13 AAAs in Washington, and we are the Southwest Washington Area Agency on Aging and Disabilities is the AAA for the 5 counties of Southwest Washington. So if you're in any of those 5 counties or have people who are in those 5 counties, we can help you. And, you know, our mission is really to promote independence, choice, well-being, and dignity for persons age 60 or older, adults with disabilities, and their families through our coordinated system of home and community-based services. So you can see here that our vision is that all of these folks have access to the information and programs and services that will help them thrive where they choose to live. So we have several programs. You've probably heard or you possibly heard of Medicaid long-term care. And long-term care was for a long time the backbone and the sole work of our agency. So we've been doing that for 30 years now, long-term care in the home through the Medicaid programs. And we authorize over $9 million in services every single month through that program in the 5 counties of Southwest Washington. And this allows seniors and adults with disabilities to stay in their home rather than in a facility if that's not where they want to be. It allows families to be able to assist. It allows folks to get personal care, transportation, emergency response systems, and other services such as this. The thing about long-term care that a lot of people know, they hear Medicaid long-term care, they know that there is potentially a state recovery involved. There are asset and income limits, and there might be a copay or what's called client participation. Some good news is that as of July 1st, that participation formula that the state uses to determine whether or not you have participation is changing, and a lot more people will be able to afford Medicaid long-term care. They'll either have a significantly less participation or no participation at all. And also, there are ways to protect your home and other assets from a state recovery if you work with like an elder law attorney. And I think that you fairly regularly, at least once a year, seems like have an elder law attorney who comes and speaks to you all about that. So I highly recommend that. I highly recommend not ever applying for Medicaid long-term care until you've spoken to an elder law attorney if you have assets. Because a lot of folks imagine they know what might happen and how to protect their assets through family trusts or other ways like that. But there are very specific rules just for Medicaid long-term care about the types of trusts that will protect your assets, and trust and other things that will protect your assets from other programs may not protect it from the state recovery and Medicaid long-term care. So that's one of the things we recommend.
Just to add a little bit to the long-term care part. So with Medicaid long-term care, you can ask a family member to care for you. And if they pass background checks and such, they can be paid to care for your loved one or care for you, but your spouse cannot. So I want to make that very clear to everyone, because I think that's a little bit confusing sometimes, is that your spouse cannot be paid to care for you, and you can't be paid to care for your spouse. Okay, a great program that we offer at AADSWA is care coordination. So we have 2 types at our agency. One is through Medicaid Apple Health Insurance, and then the other is through Humana, which is a Medicare care coordination. So we offer 2 different types. So if you need care coordination, which is just basically what it sounds like, someone to help you coordinate any type of care, whether that's mental health, physical health, exercise, getting, nutrition, dietitian, those types of things, that person can help you coordinate all of that. And so within those 2 types of care coordination programs, you can give us a call and we can find out which one you would fit into, if that's something that you would like to explore.
And that's also open to you or to a family member that you're caring for, as long as the individual meets the criteria of the program. So you could reach out and find out about that. And finally, our third area of our agency is community services. And community services serves the largest group of people in our agency. We serve over 13,000 people every year. We serve older adults, adults with disabilities, and family caregivers who are not accessing Medicaid long-term care. So you may have heard of programs like our Family Caregiver Support Program that is for a family member or friend who's providing care for a loved one. Those are the folks that we're able to assist through our community services programs. I'll let you talk about the Aging and Disability Resource Center since you recently came from there.
Yes, so I previously was a resource specialist. And so this is like where you would go. This is who you want to contact if you want to know anything about anything. Our resource specialists are very knowledgeable in what is available out there as far as resources for all sorts of things, whether that's transportation, nutrition, or if you would like to do what's called program options counseling, which is talking to them about what programs are available, and they can go through and talk to you about eligibility and see if you qualify or if your loved one qualifies. So the Resource Center is really that one-stop shop for whatever it is that you need. So I highly recommend if you have questions or you're looking for something specific and we don't have it, the resource specialist, they can find it for you.
And you can see here a big list of the kind of services that they can talk to you about. And one of those services is caregiver support. So if, as you act as a caregiver, which I know the majority of folks in this group are acting in that capacity, you're not alone. There are almost 40 million family and friend caregivers in America who are providing care to a loved one without being paid. And 90% of them are unpaid. 57% assist with actual medical tasks, and 42% of those don't have any medical training at all, but they still take on that responsibility for their loved one. 55% of caregivers report being overwhelmed. In addition to not getting paid, on average, a family caregiver loses over $300,000 in income and benefits due to giving care. So unpaid family and friend caregivers provide more than $470 billion worth of care each year. These folks, you folks all deserve some support, and that's why we're here with our Family Caregiver Support Program and our other programs that support family and friend caregivers. So if you're supporting one or more adults, two of the programs that we have are very similar, so we always talk about them together, and that's Medicaid alternative care and tailored supports for older adults. You don't have to remember the names of all these programs and figure out which one might be the best for you today. Like Chastity was talking about, you can just call the Aging and Disability Resource Center, tell them that you came and heard a presentation from the agency and you'd like to find out as a caregiver what sort of services and programs would be available for you. But MAC and TSWA, these two programs are provide supports and services to unpaid caregivers who are helping someone who's 55 or older who meets specific daily care need requirements. So there are some requirements of the amount of assistance that your loved one needs. But the income and asset limits are significantly higher in MAC and TSWA than in Medicaid long-term care. So some folks who don't qualify for Medicaid long-term care because of their income or they'd have a participation, might not under MAC or TSWA. There's no participation actually under MAC and TSWA. And there's no estate recovery, and there's no copay or participation. And MAC and TSWA both have programs that are for caregiver care receiver dyads, we call them. So if you have a care receiver, but TSWA also has an arm of its program that's available just to individuals who need assistance. So somebody who doesn't have someone in their family who's able to provide the assistance they need. So maybe you know somebody like that, a neighbor or somebody at your faith community who could benefit from something like that, who doesn't have someone to help them as much as they need help. We also have the Family Caregiver Support Program. And this program helps unpaid caregivers who take care of or support adults who are 18 and over who are in need of care. And there's no estate recovery involved again, but there might be a sliding fee for respite services, but it's entirely dependent on the income of the care receiver. So for instance, if somebody's taking care, like I took care of my grandmother, I took care of my great aunt, then assistance would have been based on their income, not mine. If you're a married couple, then the income is divided in half. And if there is any sliding fees that are required, it's based on that half income amount. And all other services under the Family Caregiver Program, though, are free. So all of the education and other services that are offered are free. And there is a huge list of services, as you can see, that may be offered under these 3 programs. I'm going to make this a little bit bigger for me. Hold on one second. So under MAC-DSWA and Family Caregiver, you may be able to, you can access information about other local services. So your case manager would be able to help you, or the ADRC, the Aging Disability Resource Center. There's also caregiver skills training to help you learn those skills that you need to provide the care, that the level of care that you're wanting to provide. There's dementia care, education, and supports. We have a program called STAR-C. It's offered to family caregivers, and it specifically addresses how to work with challenging behaviors that you may be facing when you're working with someone who has dementia. And those sorts of behaviors, you know, from pacing to getting things out of the drawers to refusal to bathe, or whatever the behavior is that you would like to see change. Also, help for caregiver depression, grief, or stress, adaptive equipment or supplies, referrals to support groups, personalized case management, emergency response systems. So there's all kinds of services that are available under these 3 programs.
Oh, so this, so we do offer a program called Kinship, and we have a Kinship Navigator. Her name is Sarah Reward. She helps grandparents, aunts, uncles, taking care of non-biological children. So like if a grandparent is taking care of their grandchildren, this program is to offer some support, whether it's either supporting the caregiver, so the grandparent, or maybe financial support. She has lots of great programs to help out with different services, and those are no cost to the caregiver. And so those things are like medical services, legal services, because sometimes in these situations there might be some adoptive paperwork. There's also understanding and navigating the system of like the DSHS system. And then there's also, like I said, the food and clothing assistance. So she has some funding that she's able to provide to those folks to help with taking care of those children.
So other programs that we have that you may not have heard of are the senior nutrition programs. So all of the congregate meal sites, when they're open, we haven't seen that in 2 years, but they're coming back. But all of the congregate meal sites, the Meals on Wheels meal sites in Clark County, and other organizations run them in some of the other counties. That's all done under the auspices of the agency. We also have the SHEBA MIPA program. And those programs, SHEBA is specifically to help folks navigate Medicare choices. So you've probably looked at some point in your life at different Medicare plans that are available to you. Well, SHEBA volunteers are highly trained, and they provide unbiased information about which of those plans may be best for you, given your medical conditions, your medications, or your loved one's situation. And MIPA, similarly, is a Medicare program that assists with enrollment and education about disease prevention and Part D information and Medicare savings plans. We also have senior transportation, legal assistance through the Northwest Justice Project. We have a long-term care ombuds program, and these folks are also highly trained. They do a lot of training, and it requires a huge commitment of their time and energy. And every single long-term care facility is assigned an ombuds person, and that person's place is to help advocate for the folks who live in those facilities, to know their rights and exercise their rights and make sure that their rights are being honored. We also have health and wellness programs. So we offer workshops and classes on oral health, chronic disease, self-management. We offer a program called Enhanced Fit, which is offered the Battleground Community Center in non-COVID times and offered online right now, but we will be going back to in-person. And we also offer, under these health and wellness programs, a program called Pearls. Would you like to talk a little bit about Pearls?
Sure.
Because Pearls is a program that's open to family caregiver, people who are involved in the Family Caregiver Support Program.
Yes. So Pearls is the program to encourage active, rewarding lives for seniors. And so what that means is myself, I would sit down with you in about 8 sessions, and we will work together to kind of try to figure out ways to combat any situation that you're having. We call them problems, but it's really how any challenges that you're facing that kind of bring you in this like whirlwind of like depression symptoms, like you're feeling lonely, you're feeling isolated, you're feeling down, you're feeling hopeless. And so the Pearls program is really designed to help you figure out a way to figure out solutions to those challenges that you're facing to kind of get you out of those funky times, those times when you're feeling really down. And also it also brings you some interesting and new ways to be more active. And we really encourage more activity, whether it's activity with being physical or activities that are social, and that could just be like chatting on the phone with your friends, or something that's really pleasant for you to do, like taking a hot bath that you don't really get time to do. So Pearls is really a great program for folks, especially caregivers, during under our FCSP or Family Caregiver Support Program, to really engage in. So if that's something that sounds interesting to you, call the Aging and Disability Resource Center and see if you would be able to get involved in that. But you do have to be part of one of our programs in order to enroll, but that's something that's really simple that you could do over the phone with the resource specialist.
We're really excited to have Chasity start doing this. It's a very effective program. It's actually been proven more effective than traditional therapies for folks who are facing social isolation or overwhelm, anxiety, depression. It's proven more effective than what we call the traditional treatments of going to a counselor, taking medication. It's much, I used to be the Pearls coach, and just the outcomes that people had and the changes that they have in their life are just amazing.
Yes, it really brings like self-confidence. You really feel like, you know what, I have a challenge coming at me, and then you know how to tackle that challenge because you've worked through it with the Pearls coach. And I've been through this challenge before, so I already know how to fix it. I already know how to get myself out of it. So it's a great program, really. Next slide, please.
Thank you. So we also have our website as a resource for you. It's really comprehensive. Like people say, check out our website, and you're going to go and look at a little activity calendar. Well, yeah, we have an activity calendar. Or you're going to go and it's going to tell you all about us. Yeah, it's going to tell you all about us. But it also has what's called active daily living guides. And active daily living guides cover aging in place and health education, especially for caregivers, covering topics like hygiene and dressing, medication management, meal preparation, avoiding falls, pain management, health concerns. There's all kinds of information about arthritis, COPD, Parkinson's, dementia, vision issues, all sorts of information in there. It's especially helpful for caregivers because it has some very practical information on how to deal with situations that you face on a regular basis. As I said, there's also the calendar of events that includes all of our wellness programs and our caregiver education and support groups, dementia education. We also do advanced care planning with folks. We teach fall prevention classes, and all of this information is available on that calendar of events. There's also a list of resources that are still specific to coronavirus for folks who are still, who are maybe more vulnerable and still staying at home, including resources for like grocery delivery or other things like that, which after 2 years, we're kind of on top of, right? We've kind of figured those things out, but it's there if you need it. So we're both available for any questions that you have on any topic related to any of our services or resources that we have available. Or if you didn't see something that you're interested in or you have questions about, go ahead and ask them, because we may have some information for you. It's likely, especially Chastity, who just spent several years being a resource specialist. So
we had our wills redone in November, and Diane's mother's will too. And we went through elder attorneys, which we were grateful for because they answered a lot of questions. And one of the things they said was that in Washington state, and every state's a little different in the amount that you can put in, but you can put in a certain amount each month to keep for future needs if the patient goes into Medicaid. Can you expound on that?
I can't. I really stay away from expanding on legal issues because, and the reason is I'm not a legal expert and they change all the time. And so I worry about giving somebody a piece of information and then to find out that the powers that be just changed it this morning. But I can absolutely agree with you that seeking out an elder law attorney, someone who is experienced in elder law specifically. And if you're looking at the possibility of Medicaid long-term care in the future for you or for your loved one, then absolutely one who knows Medicaid. There's a big difference between an attorney who does financial planning and an attorney who knows both financial rules around Medicaid. So I highly recommend, there's a website for the National Association of Elder Law Attorneys, NAELA. You can look that up. You can type in your zip code and it will give you a list of attorneys in your area, and you can read bios on them. You can see what their experience is specifically working in elder law or specifically working with Medicaid issues.
You mentioned earlier that you brought in bring in every so often an elder law attorney to speak.
Hope does. Hope does.
Okay. And
Yeah.
do you have a schedule for that, or?
Well, typically, a particular elder law attorney here in Vancouver has provided education for us every year for a number of years.
Oh, okay.
And we typically do it in around the first of the year, January or February. But we can certainly give you a list of elder law attorneys here in town.
Well, the two that we worked with seemed very competent and very good. I think they answered most of our questions, but I was just asking in general, basically. We work with Pettis Weber, and I don't know if that's anyone you know or not.
We do.
Oh, okay. And they seem very good and very in touch with people. Let's put it that way.
Yeah. Like I said, there are a number in town. And yeah, I'm glad that you have been involved with someone. You know, they all do very similar things. Some specialize in Medicaid, some specialize in estate planning, trusts, wills, you know, those sort of things. And they usually will tell you what it is that they specialize in. So,
Yes.
You might have explained this before I got here a little late. You said no estate recovery, and I don't know what that means.
Okay, so for Medicaid long-term care, there's something called estate recovery. And I'm glad that you asked about that because sometimes people misunderstand. Sometimes people think estate recovery means that if my loved one is receiving, say my spouse is receiving Medicaid is at paying loan. And under the law, the state has the right to come to you when you liquidize your assets and ask you to pay all of that back. I recommend that you seek out an elder law attorney and find out how to protect those assets.
I have a question here about other options, help. And of course, that opens to a lot of questions back to.
As it Caregiver Support Program, the Medicaid alternative care, and the tailored supports for older adults are the primary alternatives we have available within our agency. MAC and TSWA, Medicaid alternative care and tailored supports for older adults, actually Washington being always one of the top 2 states in the nation for elder care, was chosen by the federal government to do this demonstration project, we call it. And so the state of Washington was given the opportunity to operate these programs. We're now in our 6th year, and it's been proven to help keep people from having to go on Medicaid long-term, proven to help keep people in their homes longer, and it's been proven to save both federal and state tax dollars. So it hits all the right buttons, but those are 3 alternatives. Both of them do have a limited number of care hours, up to 20 hours per month of help. So in some of those programs, that's called respite, meaning they're giving you as a caregiver a break, a respite. And if it's an individual person who doesn't have a caregiver, it's called personal care, and it's the same service. So we call it different when it's really for the caregiver to take a break, or it's for individual help in the home. That's one. Those are the alternatives for especially if you're looking asset you can't, but you still have too many assets. You might be looking at an adult day center or paying for some care. Well, on the other side, they can always call a Disability Resource Center and ask all their questions.
That was one of the questions about, so can we call to
Yes.
find out about these different things?
Where did it go? There we go.
Yes, you can refer to it as program options counseling.
Program options.
Counseling.
Okay. We also have someone who is interested in meal delivery for their 94-year-old mom. Is that something that you can help with or guide people toward?
You can also call the Aging and Disability Resource Center to find out more about that. And if you're interested in joining one of our programs, the Family Caregiver Program, not Family Caregiver Program, but the MAC or TSOA program. Those programs both have home delivered meals as an option in them as well.
Is that through Meals on Wheels?
Yes.
All of the, in Clark County, all of the home delivered meal programs are managed by our agency and delivered through the Meals on Wheels people. Yes.
And do you have to meet certain criteria to be eligible for that kind of service?
For Meals on Wheels, you just have to be 60 or older. And they say that you should be like homebound, like unable to go to the grocery store and pick up your own meals, or have an inability to prepare your own meals. So that's really the criteria for Meals on Wheels. There is a fee per meal, and it's varied so much, but I think the recent cost is like $7.30.
It's 7 something per meal,
Yeah.
but
But if you can't afford it, they don't require you to pay if you have an inability to pay, but they will ask for like a donation. So if you feel like you could give like $1 per meal, then that's acceptable.
Pretty much the same as if you go to a facility, that's serving it.
Yes.
exactly,
Mhm.
exactly.
Yes.
And during COVID, they're doing frozen meals.
Yes.
They're
Mhm.
delivering once a week. They're not coming every
Yes.
day. So, but once that lifts and we go back to life as we used to know it, then they'll go back to having their volunteers delivering
Mhm.
regularly to folks.
And do you have services for people that have a decent income? But, I mean, we're caregivers for 3 different relatives.
Mhm.
One, my mother, one, my brother, and one Terry's sister. One has Parkinson's, one has fatty liver disease and doesn't have any energy and can't do a whole lot. And then my mom is 96 and has dementia,
Mhm.
or the start of it.
Mhm.
So can you kind of give me in a nutshell what programs might be available to us?
Well, that's
And the income levels are all
Different.
Different.
One, the Parkinson's one doesn't have any income problems. The other 2 are more in the middle to low income.
okay. So our Family Caregiver Support Program is on a sliding scale fee. So depending on what their income would be or is, depends, that will be what the fee would be.
And it's
So-
actually very generous. Let me say
Yeah,
that.
yeah.
So as an
Yeah,
individual person, you can make, don't quote me,
I think it's 1,800 is where the fees start.
it starts at when you make 1,800, but that's, you pay 1%
Right, and it's like 50 cents an hour.
in every percent increase.
So is
So
it based on your income or your assets?
your income.
Yeah,
Just your income?
Yes.
Oh, then
Yes.
no problem.
yeah, yes.
So you can see how when you're looking at home care that costs upwards of $37 an hour,
Mhm.
if you only have to pay 1% or even 10% of that, you know, it can be doable. It can be doable.
Can I ask a question about the home care? So if somebody calls in and they decide they want to pursue maybe a family caregiver support program, but they make too much to qualify for any caregivers outside the home, they make too much money for that, they have to pay the full price. Does the Area Agency on Aging contract with different caregiving organizations that may offer a lower price? Would they be available to a client if they were under care management?
So in the
Makes sense.
family caregiver support program, I think as a married couple, you really have to make over about $7,500 a month before you're paying 100%. So let me say that first. For most people, that's a significant amount of money to be making. So it's unlikely that somebody has to pay 100%. However, all of the contracts that the Area Agency on Aging has for caregiving services are are guided by the state guidelines of how much we are required to pay the agencies. The agencies all have to provide healthcare, have to provide a set wage. So there are no agencies really that cost less. There just really aren't any. It's not that we don't contract with them. They don't really exist.
Right, and I didn't know how COVID maybe had changed. all
Yeah.
of that. Yeah.
COVID actually raised the rates
Mhm.
that we're paying agencies through our agency because we're paying them incentives.
Well, with the Family Caregiver Support Program, if you don't need the respite or it's not really that big of a deal, there's so much of the program that you can access if you don't really need the respite right away. So that's also another option. You can get enrolled and access other things.
Tell
That's
me again about the maximum hours that someone can have a week.
It pretty much comes out to 20 hours per month.
20 hours per month.
Yes.
Okay.
Under Family Caregiver Support, Medicaid Alternative Care MAC, or Tailored Supports for Older Adults to SOA. Although they don't all work the same way, if all you wanted was in-home care, it comes out to about 20 hours. The budget is set for 20 hours a month. Now, MAC and SOA, the thing about them that's different from Family Caregiver, everything else is free. So Family Caregiver, for instance, program offers support if there's financial need for purchase of care supplies. If you've ever had to purchase incontinence supplies, you know how expensive they are. And the Family Caregiver Support Program can help with those purchases. Other supplies that I know we've offered in the past, people who have regular, let's see, I had one client one time who needed, what do you call you have to put them on if you have a port to protect yourself if there's a shower, dressings, things like that your insurance doesn't pay for and that are a financial hardship. Under the Family Caregiver Program, there's assistance for that. There's how MAC and SOA are different is MAC and SOA have a budget, a benefit amount. There's a maximum that can be spent in 6 months and you get to decide how to spend it. So if you want to spend it all on care hours, you can do that. If you want to spend part of it on care hours and part of it on meals for your care receiver, you can do that. If you want meals for you and your care receiver, and that's all you want, you can do that. If you want care supplies and hours, you can divvy up the money between the two of those. So MAC and SOA are a benefit-based program, a dollar amount that you get to decide how to spend. Family Caregiver is all free except for in-home care, which is a maximum of 20 hours a month. And that's on a sliding scale. So it may be free for you, depending on the income of the person receiving the care. Yes.
I'm thinking of a couple, she has Alzheimer's, he has had some physical problems, but he's the caregiver.
Right.
And how would they go about seeing what they could take advantage of? I mean, do you have people that go out and assess the situation, or what would be the first step?
The first step would be to call the Aging and Disability Resource Center and ask them to do
Program options.
program,
counseling.
sorry about that, program options counseling.
So that would come out to their house, or what?
They would talk to them over the phone. They would ask them questions about what their needs were, whether or not they had a unpaid family caregiver or not, or was it just them? Or if it's two spouses, it may be that they kind of help each other, but not really. They think I'm helping, and what they're doing is, let me grab you a glass of water, and that is helping, but that's not enough care, right? And so it may be that you actually have two people who need assistance and really neither one of them have a caregiver. They live in the home together and they take care of each other the best they can. And in that case, they may both be eligible to be to SOA individual clients. So to SOA, like I said, we have the dyads, the caregiver and a care receiver, but into SOA, we also have an individual who needs assistance. They can be married. They can live with other people in their house. They can even live with very able-bodied people in their house. But if those people are not providing the care that they need, then they may qualify for the TISO individual program. So they would call the Aging and Disability Resource Center, and they would say they need program options counseling.
What's the number?
That's on the slide.
We have on that table where all of the Hope Dementia stuff is, there is business cards and magnets that you can take if you like.
So just for the people online, maybe you can give the phone number.
What we will do is we will send out, if you don't mind us sending out your PowerPoint, we'll send out your PowerPoint and then whatever information such as telephone numbers and those.
Great.
And we'll just send it to everybody.
Sounds good.
So that everybody will have that. As you probably know, we very seldom go a week without mentioning the area agency on aging and disabilities in our groups. And what I tell people is, you don't know if you make too much money until you talk to somebody.
Yep. And you don't know what it will cost you until you talk to someone. And you don't know if you'll have a state recovery until you talk to someone. And
Yeah.
so it's all these things people think they know. And I'm telling you, you can do nothing better for yourself. If you own your own home or you have an asset, you can do nothing better for yourself than get a free consultation with an elder law attorney. And I'm going to give one really quick example. And that was that I had a client who whose wife went into the hospital and I didn't know it. And in the 10 days that she was in the hospital, he was convinced by a social worker that he needed to put her on Medicaid long-term care. And he had gone out and got a second mortgage on his house because they didn't qualify for Medicaid long-term care. So he called and they said, no, you don't qualify, you're over asset, you'd have to do a spend down. He's like, well, how am I going to provide care for her? Well, when you call and you ask those questions of the Maine state office, they don't have advice. They can only tell you whether you qualify or not. So he took that information that he had and he went out and took a second mortgage on his house to pay for care. And if he had gone to an elder law attorney, he could have protected his house and simply gone on, had his wife on Medicaid long-term care in the home. And so I highly recommend to always ask more questions, to always ask someone who is an expert who works at an area agency on aging, an aging and disability resource specialist, to ask an elder law attorney. Bless their hearts, they work extremely hard, but the social workers in the hospitals and rehab facilities don't always know all of the changes that are coming. They don't always know all of the rules around it, and they do the best that they can and they work very hard, but ask more questions, ask more than one person your questions.
You mentioned, go ahead.
I was gonna say, when you're talking about long-term healthcare in the home, do you see that as pretty viable way to go to respect the dignity of the person and so on and so forth? And as like the daughter of a mother that's probably headed that direction, although she's 96, so every day is a gift. So what could I expect that to look like possibly? Can you give me a scenario kind of?
Sure.
what
Now,
that could
and we're
look like?
talking about Medicaid long-term care in the
Right.
home, right? Okay. So a scenario of what that looks like and how that happens is you go and you work with your elder law attorney if mom has assets that need protecting, that she wants protected, and then you apply. And so once you apply, they're going to require proof of finances, and they're going to ask a lot of questions. They're going to want bank statements. They're going to want information about burial plots, about land or homes that are owned, property that's owned, vehicles that are owned, basically anything mom owns, they're going to want to know about, and you're going to have to provide documentation. And this includes pensions, all of that sort of stuff. Once you're accepted into the Medicaid long-term care program, then and they've shown that you're financially eligible. Also, what will happen is a social worker will come from Home and Community Services to the home and will ask 2 hours worth of questions about the care that mom needs. They'll ask questions like how many times she needs help up and down from a chair, how often someone else has to cook for her, does somebody else help her with her meds, all kinds of questions. And based on those questions, the assessment tool that they use, it has an algorithm that figures out, based on those answers, how many hours of care to provide. And then either what we call an independent individual provider, which is maybe somebody you know, or it could be even you, could be an individual provider as her daughter if you go to the 40-hour training, and could get paid by the state to help provide part of her care. Maybe it's going to be an agency and you prefer to have an agency like this one help provide care. And so they will help you set up who is going to be providing the care. And once that's all set up, they're going to hand your mother over to our assistants. And our agency is going to step in because we're the agency that helps everyone who remains in their home. The actual state program folks, they do the intake, they do the initial assessments, they get the services set up, but then they only maintain the case management connection with folks who live in a facility. Anybody who stays at home comes to our agency. And so then you would be assigned a case manager, mom would be assigned a case manager from our agency who would come out at least once a year and would be on the phone talking to you and or mom every 3 to 6 months at least, be available there for you to ask questions of, and you would have either the individual provider or the agency coming to the home for those hours that it was determined mom needed.
And she now lives in a senior secure entry apartment, no meals or anything, independent living. She could continue to live exactly where she is.
If she is renting an independent living apartment, yes. They won't pay for both assisted living and in-home care because now you're on assisted living, you're assisted living in a facility. So they'll pay for that, but it has a whole different set of rules around how much money you get to keep and how much money you have to pay and all of that.
But as long as she stays in her rented apartments, your agency could provide a lot of, would be the overseer.
Yes,
of her program.
that's correct.
I can give you an example. My 92-year-old sister-in-law is on Medicaid. She has a case manager through AAADSWA, and she has 5 hours a day, 5 days a week of caregiving based on the yearly assessment. The only thing that we have to be sure of is that they don't talk to her about what she needs.
Right.
Because
I was
she'll
thinking-
Yes,
And
yes.
then when they're asking the questions, yeah. Thank you.
So if
very
you have a
much.
power of attorney, or if mom gives permission for the case manager to speak to you, then the case manager will always make sure the answers to the questions are agreed upon by whoever is responsible for mom and will adjust the answers to those questions when necessary. Yeah.
And it's not available like in Oregon.
Mhm.
It is available in
Yes.
Oregon.
Yep.
It's not all the rules are the same.
Right.
Not all the services are the same because it's a Medicaid program and every state manages its own Medicaid programs.
But there is an Aging Disability Resource Center of Oregon.
That's what I was wondering,
Yes.
because I have some friends that could use that help.
Absolutely.
And what is the name of it? The names seem to vary state to state, sometimes county to county.
So the one in Oregon, it's for the entire state of Oregon.
Oh,
So it's just Aging and Disability Resource Center of Oregon.
okay.
Yep.
That's nice.
Yeah.
And like we said, there's over 600 area agencies on aging across the country. Every single county and parish in the country is required to be covered by an area agency on aging. It's a federal, it's called the Older Americans Act. and it's a federal law. And so anywhere you go in the country, anywhere you know people in the country who have these kind of questions, you can tell them, call your area agency on aging. They may not be and disabilities. They may only be area agency on aging, but they will be there somewhere in some capacity. Services vary greatly. We are lucky to live in Washington. As I said, consistently, we fight with Minnesota for first in the country in elder care. So it goes back and forth. But so the services here are very robust.
Well, it's good to hear that Minnesota is in the top too, because Diane has a sister and brother-in-law there.
That is good.
But, and he may be in need of some help eventually, but my question is, and it's not really a question, I guess, you covered pretty well that spouses cannot get paid for helping their spouses. My question, I think you pretty well covered this in a sense. If Diane wanted to get paid through the estate for helping her,
Yes.
and a footnote to that is we have never accepted anything for helping her, and we don't intend to. But I just wanted to cover that.
Yes, anyone in your family can care and get paid for this by the state to care for her.
And what is the acronym? It's COPES, but I never remember what it stands
Oh,
for.
gosh.
Don't ask
Oh,
those sort
sorry.
of questions. There are so many acronyms in the world of work, and it's not just COPES. That's the thing. Medicaid long-term care is not just COPES. That's only one of the Medicaid long-term care programs. So really at a state level, we just call it state-funded long-term services and supports.
Yep.
But when you know, as the old hospital person, then we would often hear people advise to go ahead and get your 40 hours and become your mother's COPES caregiver so that you can get compensated for providing care in the home.
So you can do the 40 hours anytime. I mean, you have to be on Medicaid to do the 40 hours.
So to get paid by the state to take care of a family member who is not your spouse, your family member has to be on Medicaid long-term care. Yes. The other programs only, right now, MAC and TSOA only use agencies, CSP only uses agencies. We will be we're planning in 2023, that's the goal for MAC and TSOA programs to also have independent providers. And so then there would be the possibility that a family member, not non-spouse family member, would be able to be paid those 20 hours. But in those programs, we're really pushing, especially for family caregivers, we want you to get a break. That's why these programs exist.
Right.
So we want you to have a break. Yeah. And if mom's only getting 100 hours, then you want to start thinking, do I really want to work 40 hours of those 100 hours, or do I want somebody else to do it? You know? Yeah. So,
Go ahead.
I had a question about the disability part of it.
Mhm.
So my fiance, he has an 8-year-old who's disabled, and I just wanted to know some of the benefits that she's eligible for when she turns 18. Is she eligible for Medicaid at all, or would it go off of the parent's income?
Ooh, that's loaded. Because currently, because she's under the age of 18, she would need to go through DDA, which is the
Developmental
yes.
Disabilities
Thank you.
Administration,
yes.
Developmental Disability Association,
Yeah, so
Administration.
She would have to go through them to get services. Once she turns 18, if she is eligible for services with them and then turns 18, she could potentially still qualify for services with an agency like ours. But looking at her income for eligibility, it would be whether or not she gets like Social Security disability benefits. And so they would look at that, and then potentially looking at the parents' income, but I don't think so, but you don't quote me on that for sure.
No, it's pretty long-term. obviously.
It's a long-term
Yeah.
question, yeah, and
Kind of oversee that and plan for the future.
Yeah.
right. And so, and our agency specifically works with adults with disabilities.
Right.
So it's harder for us to answer those questions, but you can always call the state office
Mhm.
and ask more questions about the services that might be available for her, depending on what her disabilities are.
Right, and
So-
there are adult family homes that are
Mhm.
Yes,
who are very severely disabled.
Yes.
yes.
They can't take care of
There's quite a few that actually come here to the day center as well.
Mhm.
Yeah.
For a little bit of break for the,
Yeah.
for the families.
The day centers are great for that.
Oh, yeah.
Are great for folks who have developmental disabilities
Mhm.
or physical disabilities that are more severe. They do all kinds of activities and it's a great opportunity for socialization. Also, not just for those folks, but also for seniors with dementia. Sometimes even seniors who have earlier stage dementia might enjoy going to an adult day center if they like working with people.
Mhm.
I know when I visited one adult day center, they had one gentleman who helped with lunches and other things like that. And it was just a good opportunity for him to feel useful and to socialize. So,
So there's volunteer options for. If my mom.
Oh, yes, there's tons. Mhm.
yeah, and if you want to know about volunteer opportunities for people over the age of 60, you could also call the Aging Disability
Yes.
Resource Center and
Yeah.
they could hook you up with some
Yes.
possibilities.
And if you have more questions about, was it your fiance or your boyfriend's daughter?
Yeah, my fiance's daughter.
Yeah.
She's 8 and
You can contact Aging and Disability Resource Center and they can provide you what information that we have on developmental disabilities. So,
So talking about calling the resource center,
yes.
we have still, even though you have vastly increased your staff,
Yeah.
we have people say, well, I called and they never called back, or I called and I left a message. And, our response is all, we'll call again.
Yes.
Is there any,
If someone did not get a return call, they didn't answer their phone. Like,
Can
honestly,
guarantee it.
100%, we call every single person who calls us and we call multiple times. We are required to follow up at least twice. And so we do call every single person. So if they didn't get a call back, I'm really sorry. But that's really, really unlikely. And then,
but I
if,
think that's a good thing to know.
yes,
To be able to share.
yes,
that,
yes. And we try to call within 24 hours, but sometimes it gets pushed out to 48. But we're in that 48-hour window of calling people back. Unless it's a weekend, of course, then kind of in the air, but
42 business days.
yes, 2 business days,
Yeah.
yes.
And we really are. I mean, those are highly monitored.
Yes,
The systems that we use
Yeah.
monitor every phone call that's made. And so,
yes.
I don't know what the solution is to the problem, but I do know the problem, and that is that a lot of people will not answer their phone if they don't recognize the number.
Yep.
Because of all the scam calls that are on all the time.
Yeah, and the unfortunate part is that with remote working for our resource specialists, they have to use their own cell phones. And so when they return calls, it comes up unavailable because they don't want their personal numbers to go out to folks in the community. And so sometimes that causes some problems with people not answering.
But if you
so-
leave a message
Yes,
and say, this is where I'm calling from, they'll call back, because I screen my calls all the time, and if they don't leave a message, I figure it's spam.
yeah, yeah. We always leave a voicemail if we can.
I was also told that if somebody, a caregiver might not have time to call or wait for a return call, that they can give permission to somebody else to make that call
Mhm.
to the resource center to
Yes.
provide information and give an approximate day and time that
Yep.
would be a good callback time.
Yep,
Is that
yes,
still?
yep, we can do that too. If you call and leave us a voicemail, we can and let us know, hey, this is my address. Can you send me information? This is my email address. Can you send me an email? They can do that too. The only thing that we don't have yet is text messaging. But I'm hoping that that's in the works because that would be great. So,
Another question is related to the sense of urgency related to, an example is someone who is highly stressed in one of our groups and badly needs to speak to a counselor and has been pushed out weeks and weeks and weeks. And is there another recommendation? Is there something else that can be done?
So if they're experiencing sadness, disconnect, social isolation, and other, and they're feeling other things that are in that similar vein, and they're in the family caregiver program, and they've been unable to get an appointment with their counselor, then they could request a PEARLS referral. As I said, PEARLS is at least as effective, if not more effective, and has been proven through the research at UW to be more effective than talk therapy and medication. So if they are experiencing feeling down, depressed, socially isolated, and they have problems or challenges in life that they would like to overcome, and they're willing to work on those with a PEARLS coach, then they could request a PEARLS referral while they wait for their counseling to start or alongside their counseling, either.
I think they expect the PEARLS referral to come in more quickly.
Right now, they will come in very quickly because the PEARLS program was closed for a year. And so right now the PEARLS program has
I have 6.
6, and we have space for 24.
See, I thought it was closed. I thought you didn't have the program anymore.
We just
Yeah.
reopened it.
I can't tell you what nice thing that is.
It's a fantastic program. It's an amazing program.
You might fill up quickly.
You do, as she said, have to be in one of our other programs, to access PEARLS, but
Yeah, well, it was very, very new to the agency, but they're long enough that she has requested and been told, great, this many weeks out.
and that's not just that's not
Oh,
just
no,
the
no, she-
counselors that our agency contracts
Yeah.
with. I'm telling you, there's a shortage nationwide.
She has tried.
And there is a sharp increase over the last 6 years of folks who are seeking counseling assistance. And we do not have enough counselors in this country. And we also don't have enough mental health insurance benefits that pay for people to see counselors. So even if there were counselors available, folks might not have a way to pay. So it's a crisis. It's a crisis.
How desperate do you have to be to go
To counseling.
to the Pearl?
Oh, you got the PEARLS coach right here. So
So my referrals come from case managers of the different programs. So Family Caregiver Support Program, Medicaid, Care Coordination, and then we also have some side programs that I won't mention because those are kind of difficult to get into. But so those programs that those case managers and care coordinators send me the referrals, and those referrals are based off of the assessment that the case manager had with that person. And so they ask questions that kind of fall under like those PHQ-9s, which is
basically we're going to ask you 2 questions. How many days in the last 2 weeks have you felt
Yes.
down, sad, down, or disinterested in life?
Yes.
How many days?
Yes.
And if you tell me more than half the days, and you have challenges or issues in life that you are interested in addressing in a proactive way and solving problems, solving those challenges, then you will likely screen into PEARLS.
Yes. Yes.
So that's how desperate you have to be. You have to be willing to tell us the truth about how many days in the last 2 weeks you have felt down, depressed, or disinterested in doing things that you normally enjoy.
Yes.
And is that just the caregiver or it can be the,
No, it can
Care
also be the care receiver.
Mhm.
So if you're in the Family Caregiver Support Program and your care receiver is competent to participate in such a program, of course, if someone has advanced dementia, they're not going to be able to be doing problem solving and making, plans for how they're going to deal with their problems. But if your care receiver is able to do that, then they are also eligible to be screened for the program. Yep. I've worked with caregiver and care receiver. I mean, I work with them, when I did Pearls, I worked with them separately, but I worked with, folks, a caregiver and a care receiver who lived in the same home together before. It was quite effective for them.
Would you recommend that when somebody becomes a caregiver, that they call the agency right away, whether they know they need help? or
Thank
not?
you for saying that, because I've been thinking for the last half an hour. Remember to say this. And what I want to say is ask for help before you need it. No, I don't need any help. Great. Call the Aging and Disability Resource Center and see if you qualify for the Family Caregiver Support Program. There are 3 tiers to that program. And at every tier, there are support services that will be available to you. And at tier 3, which is when you're at your most stress, is when you get the most services. But what you hear Lynn saying is, do you, at that point, when you're already completely stressed out, do you want to wait 6 or 8 weeks to see a counselor? Do you want to wait 8 or 12 weeks to get a home care aide in the house?
15.
It can be up to 4 months right now. They're like a lot of jobs right now. There is a shortage of home care aides. Well, there was already a shortage of home care aides before the COVID pandemic. And now it's just gotten worse with time because, the providing care going into people's homes in the time of a pandemic can be a little scary, both for the home care aide and for the folks living in the home. And so a lot of folks quit, and you can be waiting up to 4 months. So don't wait until you're at your most stressed out and you're about to fall over the cliff and there's no knot in your rope. When you start caregiving, call the ADRC and ask about what's available to help support you.
I can't tell you how often that we will hear people say, oh, we're not ready for that.
Mhm.
Those exact words.
When you're ready for it, it's almost too late. And some of the statistics I didn't share and the things I didn't share are that after 5 years of caregiving, a lot of caregivers are in worse shape than their care receiver because they've had 5 years of putting that other person before them. I've had caregivers who haven't been to a doctor in 5 years and they have ongoing health issues, but there's no time for their doctor appointment, but they always have time for their care receiver's doctor appointment. And that's understandable. You want to provide the best care, the highest level of care you can to the folks that you love. But it's like that old thing that we say, like you can't fill someone else's cup from your empty cup. And so get help for somebody to start pouring in your cup while you're still drinking out of it, while there's still something in it.
Thank you. Any other questions? Okay, well, thank you guys
Absolutely.
so much. I hope you know how much we value you.
I hope you all know how much we value hope.
Yes, love hope.
We love this group.
And thank you for validating us going to an elder
Yeah.
law person.
Oh, that'll never be a wrong move.
No.
Never.
So we have someone that says that she's encouraged to hear that there are programs and services available.
Excellent.
Awesome.
So thank you guys.
Yes, absolutely. Thank you for inviting us.
Yeah.
And for everybody who is on Zoom and everybody who is here, we are education next month is about fall prevention in the home. And it is by a physical therapist from Providence. So who specializes in fall prevention for people, elders and people with dementia. So it should be very much with them. And I will, we will send out the PowerPoint and the other information that you wanted, the phone numbers and such. And the video will be on Facebook and on our YouTube channel by Friday. We've gotten it down to a science. So thanks everyone for being here.
Thank you.
Thank you.